Namaste Vidya, Hamesha खुश रहो. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH-FHS University, Jain. In today's clinical lecture, we are going to discuss about the various investigations that could be done while doing the psychiatric assessment of the patient. So what are the various investigations that are needed to be done for doing psychiatric assessment of a patient with a psychiatric disorder who is coming to you? First of all, there is medical screening should be done. The following test may be useful in screening for the medical disorders that is causing psychiatric symptoms. Number one is hemoglobin. This is done as a routine. Next is the total and differential leukocyte counts, that is TLC and DLC. We can take the peripheral smear and do the urine analysis. Various liver function tests are done to monitor the treatment with carbamazepine, valproate, benzodiazepine, alcohol dependence. Next, you can check for serum sodium and potassium levels for SIADH due to antipsychotic drugs. You can check for various blood glucose levels for diabetes mellitus. Then we can do the thyroid function test for refractory depression, rapid cycling mood disorders, and treatment with lithium carbamazepine. Next important investigation, I will just repeat these investigations once again if it is too fast. There are medical screening, which includes hemoglobin, which is done as a routine. TLC and DLC, that is total leukocyte count and differential leukocyte count. Peripheral smear can be done. Urine analysis. Liver function test, serum sodium and potassium levels, blood glucose levels for diabetes, thyroid function tests. These are the tests that are done. The next important test is electrocardiogram, that is EKG, that is taken during the treatment with lithium, antidepressant, and it is done before ECT. HIV testing is done in intravenous drug users, and it is suggestive of sexual history, AIDS, and dementia. VDRL test is suggestive of sexual history. X-ray chest and skull X-ray is done in the patient with greater than 35 years of age and the treatment with ECT. CPK is increased in neuroleptic malignant syndrome. Electrocardiogram, HIV testing, VDRL, X-ray, chest and skull, CPK. The next, we can do the toxicological screening that is useful when the substance use is suspected. Example, alcohol, cocaine, opiates, cannabis, phencyclidine, benzodiazepine, and barbiturates. Various drug levels can be checked. The drug levels are the indicator for therapeutic and blood toxic drug levels, and is done for testing drug compliances. Various electrophysiological tests like EEG, electroencephalogram for seizures, dementia, pseudoseizures versus seizures, episodic abnormal behavior, B, that is brain electrical activity mapping can be done. Various imaging studies like CT scans can be done. Neuroendocrinal studies includes dexamethasone suppression test, that is DST. Biochemical tests like 5-HIAA and catecholamine levels can be checked for. Various genetic studies can be done for cytogenic workup. Is useful in some cases of mental retardation. So we have electrophysiological tests, imaging studies, neuroendocrinal studies, biochemical tests, and genetic studies. You can also test for various kinds of sexual disorders, which includes papaverine test for male erectile dysfunction disorders. And there are various miscellaneous tests like lactate provocation test in case of parent disorders, which could be done. Last one is the CSF examination for meningitis. This is done by lumbar puncture method. So this was all about the various investigation that could be done in case of psychiatric assessment. In the next lecture, we are going to discuss about the various psychological tests that are done in case of psychiatric disorders. This session is powered by Digital Version 2.0, JAYOTI VIDYAPEETH-FHS University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve. This was all for today. Thank you very much. We will be meeting in the next lecture tomorrow.